Okay, briefly now we'll be looking at informatics and point of care testing. Okay, now informatics and point of care testing is basically um, those things that you are looking out for. Okay, so that they can give you information about a point of care testing that was conducted. Do you understand? That's what the concept of informatics and point of care testing means. Okay, so maybe there was a test that another doctor actually went to a patient house to perform or conduct. Now, this test actually came to your table in the hospital. So, how can you be able to decipher the information from this test, right? What are the things that you are supposed to be looking at? Okay, so informatics and point of care testing. Point of care testing, just like we know, is basically trying to bring the medical services closer to the patient, right? So now let's define the two terminologies, which is informatics and point of care testing. Now, informatics is a study of structure, behavior, and interactions of what natural and engineering computational systems, right? Now, informatics studies the representation, processing, and communication of information in natural and engineered systems. It has computational, cognitive, and social aspects. Okay, so this is just trying to tell you guys that okay, a point of care testing result. Okay, there are some encoding on it. Okay, that you are trying to watch out for, like the date it was conducted, the patient, and all this. All those stuffs are informatics. Okay, then how about point of care testing? Point of care testing, also known as what near patient testing or bedside testing, is defined as a medical diagnosis testing at or near the point of care. That is, at the time and place of patient care. Do you understand? Mostly done near the patient. Okay, these are various equipment that can be used in point of care testing. All right. So what are the informatics that we are basically looking at if you hold up a result of point of care? You are looking at the patient, maybe the patient name. Okay. You are looking at the sample that the doctor that performed that test actually collected. You are looking at the operator, that's the name of the doctor. You are looking at the device identifier. Is if they actually use any device at the point of care, you are looking at that. Then you also look at the date and time of specimen collection and analysis, okay? So that you know the time which uh, it took them to actually collect the specimen and the time to which the testing was conducted, okay? And this will actually help you verify if the test result was correct, okay? Then you look at the type of specimen that was collected. Um, you look at the test requested and test results with appropriate units. Okay, try to look at if everything was represented the right way. Then you look at if the doctor actually included any error messages or action messages. Okay, so these are the various informatics that you should be looking at if you basically get a hold of a point of care result. Okay, so that's it about informatics and point of care testing. I'll be seeing you guys in the next.